I had actually been to a gyne when I was 16, and I had told her all of my symptoms. I didn't even hear the word endometriosis come out of her mouth.
I was 15, and I've been to numerous doctors by that point. Never heard of the word endometriosis a day in my life. Not from anybody.
Ultimately, Jackie self-diagnosed.
I had just turned 10, and right away the symptoms started, but as I got older, the symptoms started to worsen. I was experiencing really bad pelvic pain and nausea, and I had had a period for 3 months straight, all summer.
I got my first period at 11, and I think I always had symptoms. I always had painful periods.
On that first period is something that I would not like to experience ever again. It was extreme pain. It began in the nighttime. It went on for at least 3 days.
During my sophomore and junior year, I would have a lot of pressure and then stabbing pain in my lower abdomen, and these symptoms made it really difficult to focus in class, to go to class, to play sports.
I was often bullied for missing so much school that I really didn't talk about it. I isolated myself from friends and peers because I didn't think they'd understand.
I was a professional ballet ballroom dancer. It was fun, it was loving. I had to stop that.
I was a competitive cheerleader growing up, and I remember having to sit out a lot. I remember missing competitions. There were games that I would miss. I remember that was really, really isolating for me.
It doesn't necessarily happen to everyone, but it's happening to such a large group of people that almost every person is probably going to know someone who has been affected by endometriosis or gynecologic disorder.
Just because I can't get endometriosis, I'm definitely affected by it. I mean, my wife, has had it, and it heavily affects both of us every single day.
My earliest memories are being in the hospital with my mom.
Regardless of what your gender identity is, if you're experiencing these symptoms, it doesn't make your experience or your pain any less valid.
I would say to men that physical, mental, and financial health all go hand in hand, and in endometriosis, the disease is attacking all three.
When I first started posting about it, I was really nervous because, again, it's a taboo subject, and I didn't expect to get any responses. I was shocked that so many other people felt comfortable enough to reach out simply because I shared a few posts.
I worry about my sister. I have a younger sister, and so she doesn't have any symptoms yet, but we've talked about it and just kind of what to look out for.
It took 24 years for my mom to be able to talk to people comfortably about something that she'd been going through her whole life.
Do not feel embarrassed, because being embarrassed, being shy, being silent isn't gonna help you.
Telling my own story was special because I got lots of DMs. There were other South Asian girls like me that thought their period problems were normal that are now seeing OBGYNs for the first time.
Just start talking to your family and friends about it, because there's probably more people out there who are experiencing these symptoms than you know.
My advice would be to follow your instincts and to trust yourself. As a patient, you know your body more than anyone else.
My pediatrician, whenever I would bring it up, he just didn't seem to understand what I was going through.
It's okay if you're having problems, and it's okay to talk about it.
Trust your gut of what you're feeling and not what people might think you're feeling. Don't let people silence you.